ever I'm paying directly for my medications. I was staggered when I found out that one of my antidepressants, a 3-month supply, is $845. Okay, now, I have a health savings account that ultimately I can reimburse myself, and even if I couldn't, I'd still be okay. But for many people, that would end any thought of getting treatment. That would end any thought of getting on antidepressants or getting on blood pressure managing drugs or anything else. So how is that affecting? How is that affecting the people that you see? Phil, what's happening with that?
It's a very complicated question.
Thank you.
So there are a lot of components, but in my experience in Dexter, I'm seeing a lot more new patients because of the Affordable Care. People who didn't have insurance before. I'm also seeing a lot of people saying they can't, like you said, afford, not so much because of the ACA, but because their employer got now at Michigan, we've gone from $15 to $30 in the last 3 years copay. And that's a lot of money for somebody who's making $25,000, $30,000 a year. So that's a short answer to how that's affected. There are a lot of other things too, like the drug company, who we don't accept any drug detailing, but some private docs do. And they leave samples, and then you give the patient the samples, and then when they run, they get the prescription, it's the $145. And sometimes that's the only drug. But I think one thing is to think about generics. Most generics, but I would say 80% of mental health drugs are now have a generic. Like only 80%, but that is 80%, much cheaper. You're talking about $30 versus $800.
So what you're saying is that the doc works with the patient to figure out what can we find for you that
That's
you
exactly
can
what happens all the time. Sometimes they can only be, they've tried all these, or they're on a brand name that's the only one in the class. Then you have to work with the insurance company, or you work with the drug rebate programs, or you work with whoever. Sometimes it just doesn't work. And then we're kind of in a difficult position. When I did my sabbatical 11 years ago in England and London, it was so different. Not one time did anybody ever think about money for patient care or medication, because you got covered.
Yeah, I never did until I had to pay $845 for my...
But it's so different there, and people get what they need. But anyway, it can be difficult.
So Danielle, when you work with patients, you were talking about anxiety around managing a condition. Do you see this kind of anxiety from folks?
Yes, absolutely. And it's getting right at the heart of what social workers are. I mean, part of what we do is trying to help people access their care and have it be affordable and figure that out. It's not always possible. It really just isn't. That's the reality of it. And yes, I've lost patients but having them fall out of care. And I try and spend a good part of, or at least some part of my week every week of a full-time job trying to track some of them down and kind of reach out to them by phone and connect them that way. It's not nearly sufficient as therapy or as being able to follow with medication would be, but I definitely I could probably even start to name names if I wanted to of the people who I really wish that I could scoop back up and get back in to some sort of program or care, but they can't afford it. The Affordable Care Act has helped. I think just even in the 6 months that I've been in the clinic here, I've seen a lot more people get access to coverage and care that they didn't have access before, and they have a little bit more medication option within that. But there's also a group of folks with the deductibles. The $700 deductible is just, it's not, you can't do that. It doesn't work.